We have a male bear, looks about 30 years old. He slipped on a banana peel, flew through the window, and landed on his right side from 2 stories high. His left side seems clear, besides a few minor cuts from the broken glass.
We need to take a look at his axial skeleton, which includes his head, neck, and trunk, for any other internal injuries from the impact of the glass. His appendicular skeleton, specifically his limbs, need to be checked for any fractures. His cut should be treated for as well.
Are the majority of his injuries superior to the hip bone, that is, from the hips towards the head, or are they inferior to the hip bone, from the hip bone away from the head? And also, does he have any known injuries to the posterior side of his body, or the majorities of the wounds on the anterior side?
He has no injuries to the medial part or toward the midline of his posterior or toward the backside. However, there are some small cuts from where he fell that are lateral or away from the midline to his spine. So I would say the damage occurred mostly on the anterior side.
Oh, we ran an x-ray and... Are we going?
Yeah.
Okay, well I messed up like 6 times.
Just keep going.
We ran an x-ray and it seems that he has a fracture in his right arm, which is proximal to the limb's attachment to the wrist, as well as some cuts that are distal or farther from the limb's attachment to the elbow. The cuts are very superficial in this particular place.
Because of the large mass of glass deep in his ventral cavity, close to the heart, we have to send the patient to the OR. This basically means that there is a large mass of glass that penetrates below the body surface in the stomach region.
We examined his cranial cavity within the skull and the vertebral cavity, which includes his spinal column. The only damage to his dorsal cavity or the posterior is a minor concussion from the fall. The thoracic cavity, or the area containing the heart and lungs, are at risk because of the location of the mass is just inferior to his heart.
The abdominal pelvic cavity is clear, which means there is no damage to the stomach, spleen, bladder, or any other organs in the abdominal or pelvic area. However, we need to make an incision along the patient's sagittal plane or longitudinal in order to remove the glass without piercing the heart.
The heart is located along the mid-sagittal plane or along the midline, so we also have to avoid creating any additional damage.
Would you like to make the incision?
Yes.
Sophia! You killed it!
I was just a student.
We need cotton. We need packing. He's dead. He's gone. Oh my god. Zoom in on her face.
That was the lowest quality thing ever.
The student made an incision along the anterior frontal plane deeper than necessary, which resulted in the loss of Pete the Panda.
I will only look at the transverse or cross section superior to the hip bones in order to investigate the injuries. The right and left upper quadrants seem to be the only regions of the abdominopelvic cavity that has been glassed from the initial accident.
As he came into the ER, the right lower and left lower quadrants of the abdominal pelvic area were only affected with superficial cuts. I saw the glass in the right and left hypochondriac regions, or the regions below the rib cage, but on the right side, the right and left iliac regions, which are here, and the left and right lumbar regions are for the most part untouched.
Okay, now I will conduct my autopsy with a deep Y-shaped incision from the shoulders to the pelvic bone through the epigastric region, which is above the stomach, the umbilical region where the navel is, and the hypogastric region, which is just below the stomach.
I feel awful. Just because of my mistake, this poor bear died.
No, he's probably going to die anyways. proximal, what's that?
Closer to the attachment, like beyond his right arm, and say he has a fracture that's closer to the lens attachment.
And then cuts are distal.
Farther away from the lens attachment.
So like go.
Distal to the elbow.
I don't remember writing that. Like
Cuts are very superficial, so they're on the surface.
Yeah.
Okay, I'll just go like this.
Yeah,
and
just-
then
Okay, and then.
I'm gonna be like, do I have to scroll like add on?
Vertebral cavity.
Right.
That's it.
okay.
Wait, that's it?
It's just
like
those
after.
Well,
We're just cutting.
then you Okay.
Would you like to
So
make the
the
incision?
abdominal pelvic cavity
I'm not even gonna look down.
is. We need to make an incision along the sagittal plane.
Wait, are we going?
I was filming that for just funny moments.
Alright.
We examined his cranial cavity.
You can't be sitting up.
Oh, sorry. Oh, sorry. Okay.
2 seconds.